Again, if your only source of health information is your doctor, you're in big trouble. All right, so we've spoken about toxins, spoken about threats, some other topics we want to try and cover. I mean, we've covered some to some extent, but we're going to cover more and more in the years to come. Children's health and development, very, very important. Women's health, topics unique to men, pain problems. We've had a few people talk about pain, anti-aging, wound healing, depression, wound care. The children's aspect, where we really want to put a lot of our resources behind helping people find the best way to give their kids the best chance in life. And Dr. Jones is one of the people who are really helping us to do that. John Hall did an excellent presentation on in wound care. Actually, he's a dentist, but they've come up with an aloe technology that works on the teeth and the gum especially, and reduces inflammation. It acts as an antibiotic. It acts as an analgesic as well. So many times doctors don't even need to use those numbing anesthetics that they inject into your gum. What I just showed you recently, what he's talking about, is very, very effective, and it's being used by many dentists as a replacement. All right. Remember, we spoke about words being very important in bone health and really important in everything else. Well, I love this quote a lot too. It says, "Talk health, the dreary, never-changing tale of mortal maladies is worn and stale. You cannot charm or interest or please by harping on that minor chord, disease. Say you are well, or all is well with you, and God shall hear your words and make them true." I think it's to be regretted, really, that our teachers, our parents, our leaders, religious leaders, politicians, have not given the attention, the amazing attention that is needed to this topic of spoken words specifically. Oh my goodness, if we only knew how our spoken words affect our physical bodies and our minds, we would change the way we speak. We would change the kind of talk we indulge in. And so that's one of the reasons why I did a preliminary talk on words and how they affect our health. I'm going to be doing more next year. Another topic of interest, quality of life, your rights, your choice, your opportunity. Lori Morris, she did a great presentation, and she's going to be back next week to speak about the health benefits of gratitude and giving. Sherry, have you contacted her about this? Did she call you back? Did you guys talk about anything?
Yes, if anybody knows Lori, tell her to call me back.
Okay. Yeah, Lori is a wonderful speaker. Okay, what happens? Well, we've spoken about, for the most part, we've spoken about what the body needs, how the body functions, the toxins we should avoid. But what happens when, well, the body just fails, it breaks down? Well, obviously that happens, that's what happens in disease. And so we're also getting speakers to address specific diseases. Now, we're not getting these speakers to tell you what you need, what medications you need to do, or whether you should choose surgery or not. Absolutely not. We would not be that presumptuous. Our focus is on helping you give your body, helping you know what to do to give your body the best chance of recovery during treatment and after treatment. You see, no, it doesn't matter what your doctor is doing. There are still needs that your body has that need to be addressed. And if all you're going to do is just wait for your doctor to tell you what to do, well, you're way behind the eight ball. I mean, you're just not in the game. God help you. Mm-hmm. Let your doctor take care of your disease. You take care of your health. They are not the same thing. Okay, Dr. Murray spoke about cancer, and here are those nasty-looking cells just multiplying. That's what cancer does. It just multiplies. Is cancer necessarily a death a death sentence? Of course not. But many times we feel it's such, and so that's why fear grips us. But if we had the knowledge to deal with, to give our bodies healthy stuff and to help our bodies fight the cancer while the doctor's taking care of it, trust me, I having trained in radiation oncology, I know the power of good medication to help either slow down the cancer or destroy the cancer. But at the same time, it also damages the cells in your body, and therefore you must become acquainted with the power of nutrition to help protect the cells in your body. And there are our slides going on. Okay, cardiovascular conditions. Again, Dr. Harry and Dr. Steve spoke about arginine. While your doctor is treating you, while you're doing whatever you need to do to regain health, remember that arginine is extremely important to help in repair of damage to blood vessels, the lining of blood vessels. It helps your heart work better. So while you're receiving treatment, you got to give your cardiovascular system what it needs. Speaking about cholesterol, high cholesterol, hormones, hot flashes, blah, 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 the things that happen to ladies when, well, they reach a certain stage in life. Dr. Coolidge did a presentation on that. And we just don't want to just stay with just disease and health problems. Well, we also want to talk about life as a whole. And I like to refer to the scope of what we want to accomplish with our webinars, our website. And trust me, folks, that website is nowhere near what it's meant to be. I mean, there are tons of stuff we want to add. We want to add health jokes. We want to add articles. We want to add videos to it. I mean, it's going to be transformed. We're just working on some minor tweaks and tweaks to get it done, fixed properly. By the way, if you're not a member and you're still thinking about it, just know this. By next year, January, the prices are going to almost double. They're going to almost double. Trust us. If I know we've been threatening to do that, it's for real this time. And really, the reason why I was saying this is because, I mean, $15 a month is such a great deal for what you get. I mean, do you have any idea how much you would have to pay for these things that we're supplying? And really, some of the things that we have on our sites are not anywhere else, because why? These presentations were created specifically for us. I specifically asked these presenters, doctors, healthcare professionals to focus on this specific topic. Ask them to draw pictures. Ask them to create slides that focus on that particular topic. So if you think you're going to just go out and get these topics outside, think again. All right. I like to cover, like I said, the 7 laws of life: our words, our beliefs, our thoughts, what we put in our mouths, how we use our bodies. That would, of course, include exercise, drug use or abuse, your exercise, body movements, smoking or non-smoking, the people we associate with, the sort of work you do. So few people understand the importance of that. So few people understand that if you don't enjoy your work, like we said earlier on today, if you don't enjoy your work, that can cause your health to break down. And it talks, if you get all this right, if you really apply the 7 laws, well, you can be said to be walking in wisdom. Wisdom for daily living. Wisdom is organized life by Immanuel Kant. And a person who is really walking in wisdom is having his spirit, mind, and body strengthened on a daily basis. And that is that person who is truly living in health, which is a state of complete physical, mental, and social well-being. How many people do you know who are like that, Sherry?
Not enough.
I know very few. It is a state of complete physical, mental, and social well-being. I think that covers a lot, and not merely the absence of disease or infirmity. All right, I had a few more slides here. And again, folks, the question is, it's going to be up to you. You are not going to like everything we have on our sites. We're covering a wide range of topics and interests because we want to cover everything to do with health. Some people have been very upset with us for promoting other nutritional companies, and they've left, and that's fine. It's going to be up to you. Again, our goal is not to make enemies of you, but to present the people of the world with the information, the best forms of information that are out there so that they can make the right decisions about their minds, what they do with their minds and their bodies. So in the final analysis, it's about you. It's about you taking intelligent action. It's about you taking responsibility and not waiting for someone to take responsibility for you. And when